For everyday GP matters, we're still trying to provide the best service we possibly can for you. It does mean that we're going to be doing this slightly differently in the future, and both telephone and video consultations are likely to play a big part in this. Some of the practices, including ourselves at Clarendon Lodge, have been telephone consulting for quite a long time now, and we're quite used to it. But for the other practices that are starting out on this road, please be patient with them, because it's quite a difficult thing to master, and it will take a while before people feel entirely comfortable, both patient and doctor, with that new way of working. The video linking is also another way of us gaining a little bit of extra information sometimes, where just talking to someone won't quite do. It's a very safe and secure service, and we will be making sure that we can see you quite clearly when we need to have a look at something such as, say, a swollen hand, that we wouldn't be able to work out quite what was going on by the telephone alone. We don't mind if you're in your pyjamas. We accept that people who are self-isolating might not get out of them all day. And so don't worry about what you look like. It's not that we're interested in. We just want to get more information so that we can make the best judgment possible before deciding what to do to help you. If you need medicines, we'll probably have to send those to the local pharmacy near you so that you can collect them from there later. All of this is designed really to try and stop people having to come to the surgery, to reduce their risk of getting infection on the outside world, and reduce the risk to our staff from picking it up from people who might not realise they've got the infection but are bringing it into the surgery. For those of you who think you've got symptoms of the COVID virus, it's really important to use the appropriate and really good service out there on the 111 service. That can be reached by telephone, but our advice generally is to go onto the 111 online service, because they've got a really good click-through diagnostic tool where you put your information in. It will give you really sound advice as to what you should do next. I've spoken to some hospital colleagues recently. It's clearly a very different landscape for them. This is circumstances never seen before, and the hospitals are gearing up to help look after lots of poorly people who may be suffering from the COVID virus and other conditions, of course, who will be admitted over the next few weeks. It's highly likely, therefore, that the routine activity of the hospital won't be the same as it has been for a long time. Things like regular routine operations will be cancelled and delayed, possibly for quite some time. Routine outpatient clinics will be cancelled or delayed, or potentially done over the telephone, in the same way that we talked earlier about the GPs doing their work over the telephone. I think the hospitals will be having to shift to this too. It's a difficult time for them as well, and they're perhaps even more at the front line in terms of seeing the sickest patients with COVID symptoms, and the extra efforts they're going to have to make to deal with that will be very challenging for them too. So please be patient with them as well. And if you have issues regarding your ongoing health relating to referrals that you've had or surgery that you're expecting, the GP practices can deal with some of those queries. A lot of those queries can be dealt with in online forms. So if you go to your practice website, it's the first entry port, and there may be a form you can fill in there electronically, which then can be dealt with in the routine way. A lot of you are very, very worried about getting your medicines. Please be patient. The practices are having to deal with an incredibly large number of requests for medications, some of which isn't necessarily entirely appropriate because you haven't had those medications for a very long time, and be prepared for the doctors to be giving you a call to try and work out whether they're really needed or not. We'd also like to ask on behalf of our pharmacy colleagues that you don't request medications earlier than usual. There are no supply problems at the moment, and there won't be so long as everyone stays calm, stays sensible, and orders the medications at the right time. Otherwise, it'll be like the bog rolls. If people order them too much too early, they'll all be gone and there won't be any for everybody else. So please be reasonable. Please ask what you would usually get and how often you would usually get it. That way it'll make sure that the pharmacist can get your medications in on time for you to have for the next time, so that there's nobody going to run out and everyone will be safe. There's also quite a few questions around about certain medications and the COVID virus. In particular, this relates to the use of ibuprofen. The evidence is very much uncertain about this, and our advice currently would be, while there is some doubt, we would probably recommend the use of paracetamol if you get COVID symptoms and not ibuprofen. But if you're taking ibuprofen or another regular anti-inflammatory like naproxen, please don't stop it in the anticipation that you might get symptoms, because you might never get them. And it's better to take your medication as prescribed by the doctor for now, and then perhaps if you do get symptoms of the COVID virus, think about stopping it then. In my 25 years of general practice experience, there's never, ever been a time like this. We've had dealings before with SARS and with bird flu, but nothing has been quite as impactful as the COVID virus on us, our patients, and the wider community. What I really want to do is to give you an idea of what we are trying to do to help you as individuals, to do that as GPs ourselves, but as practice GPs, but also in the wider general practice community as the primary care network. We need to try and protect our vulnerable as much as possible, to help people to look after themselves, and to make life as manageable as possible through these next difficult weeks and months. And we have to be honest and look at the ways that we can help people in perhaps the last days of their life, should they succumb to the COVID virus.